Question 1. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? A. Peaches. B. Cottage cheese. C. Popsicle. D. Lima beans. Correct answer, C. Popsicle. Question 1 explanation. Hydration is important in the client with sickle cell disease to prevent thrombus formation. Popsicles, gelatin, juice, and pudding have high fluid content. Options A, B, and D do not aid in hydration and are, therefore, incorrect. Question 2. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura, ATP. The client's platelet count currently is 80. It will be most important to teach the client and family about A. Bleeding precautions. B. Prevention of falls. C. Oxygen therapy. D. Conservation of energy. Correct answer, A. Bleeding precautions. Question 2 explanation. The normal platelet count is 120,000 to 400. Bleeding occurs in clients with low platelets. The priority is to prevent and minimize bleeding. Options B and D are of lesser priority and are incorrect in this instance. Option C is important, but platelets do not carry oxygen. Question 3. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear and anxiety about the procedure. Which of the following is the most effective nursing response? A. Warn the patient to stay very still because the smallest movement will increase her pain. B. Encourage the family to stay in the room for the procedure. C. Stay with the patient and focus on slow, deep breathing for relaxation. D. Delay the procedure to allow the patient to deal with her feelings. Correct answer, C. Stay with the patient and focus on slow, deep breathing for relaxation. Question 3 explanation. Slow, deep breathing is the most effective method of reducing anxiety and stress. It reduces the level of carbon dioxide in the brain to increase calm and relaxation. Option A. Warning the patient to remain still will likely increase her anxiety. Option B. Encouraging family members to stay with the patient may make her worry about their anxiety as well as her own. Option D. Delaying the procedure is unlikely to allay her fears. Question 4. A nurse who organizes and establishes a political action committee, PAC, in their local community to address issues relating to the accessibility and affordability of healthcare resources in the community is serving in which capacity and role of the registered nurse? A. Client advocate. B. Collaborator. C. Politician. D. Entrepreneur. Correct answer, A. Client advocate. Question 4 explanation. A nurse who organizes and establishes a political action committee, PAC, in their local community to address issues relating to the accessibility and affordability of healthcare resources in the community is serving as the client advocate. As you should know, the definition of client includes not only individual clients and families as a unit, but also populations such as the members of the local community. Although the nurse, as the organizer of this political action committee, PAC, will have to collaborate with members of the community to promote the accessibility and affordability of healthcare resources in the community, this is a secondary role rather than the primary role. Additionally, although the nurse is serving in a political advocacy effort, the nurse is not necessarily a politician and there is no evidence that this nurse is an entrepreneur. Question 5. 14. Which type of legal consent is indirectly given by the client by the very nature of their voluntary acute care hospitalization? A. An opt-out consent. B. An implicit consent. C. An explicit consent. D. No consent at all is given. Correct answer, B. An implicit consent. Question 5 explanation. The type of legal consent that is indirectly given by the client by the very nature of their voluntary acute care hospitalization is an implicit consent. Indirectly given by the client by the very nature of their voluntary acute care hospitalization is an implicit consent. An explicit consent, on the other hand, is the direct and formal consent of the client, and an opt-out consent is given when a patient does not refuse a treatment. This lack of objections by the patient indicates that the person has consented to the treatment or procedure with an opt-out consent. Correct answer, B. Within 10 minutes of arrival. Question 6 Explanation. The goal for general assessment by an ED or stroke team physician is within 10 minutes of arrival to the ED. Within the same 10 minutes, an urgent CT without contrast should also be ordered. Question 7. It is essential that the nurse have which piece of equipment at the bedside of a client on a ventilator? A. Cardiac monitor. B. Intravenous controller. C. Manual resuscitator. D. Oxygen by nasal cannula. Correct answer, C. Manual resuscitator. Question 7 Explanation. The essential piece of equipment is the ambu bag, manual resuscitator. Ventilator clients must always have another means of ventilation, in case of a problem with the ventilator, power, and so on. Answers A and B would be needed, but not as much as answer C. Answer D would be inappropriate for a client on the ventilator. Question 8. An obviously pregnant woman comes to the emergency department. She says that her water just broke at home and she felt the umbilical cord. Which action would be a priority for the nurse? 1. Ask the client about her prenatal care. 2. Assess fetal heart rate in the emergency department. 3. Perform the McRoberts maneuver to straighten the sacrum. 4. Position the client in a knee chest position. Correct answer, 4. Position the client in a knee chest position. Question 8 Explanation. Prolapse occurs when the umbilical cord lies below the presenting part of the fetus. A loop of cord may be palpated or visualized in the vagina. The fetus is at risk of occluded circulation. An emergency cesarean section is usually required unless vaginal birth is imminent and considered safe by the healthcare provider, HCP. Positioning the client in a knee chest or Trendelenburg position is used to relieve pressure on the occluded cord. The nurse may also use a sterile gloved hand to help lift the presenting part off the cord. The hand should remain in the vagina until the HCP arrives. Other actions include administration of oxygen and intravenous fluids. Question 9. The nurse reports to the physician signs of increased intracranial pressure in an infant with a myelomeningocele who has which of the following? 1. Minimal lower extremity movement. 2. A high-pitched cry. 3. Overflow voiding only. 4. A fontanelle that bulges with crying. Question 4. A nurse who organizes and establishes a political action committee, PAC, in their local community to address issues relating to the accessibility and affordability of healthcare resources in the community is serving in which capacity and role of the registered nurse? A. Client advocate. B. Collaborator. C. Politician. D. Entrepreneur. Question 10. The nurse performing an initial newborn assessment after birth observes a bluish discoloration of the hands and feet. The trunk has a pink color. What is the nurse's initial action? 1. Apply oxygen and count respirations. 2. Assess heart sounds for a murmur. 3. Observe for expiratory grunting. 4. Place infant skin to skin with mother. Correct answer, 4. Place infant skin to skin with mother. Question 10 Explanation. Acrocyanosis is peripheral cyanosis that is considered normal during the first day of life or up to 7 to 10 days after birth if the infant becomes cold. It manifests as a bluish discoloration of the hands and feet and sometimes the skin around the mouth. It results from poor perfusion of blood to the periphery of the body as an initial mechanism to reduce heat loss and stabilize temperature. Initial nursing management is to keep the newborn warm by placing skin to skin with the mother under a radiant warmer. The nurse should also frequently assess axillary temperature to ensure that the newborn is properly retaining body heat. Stable body temperature is generally reached within 6 to 12 hours after birth. Question 11. The nurse at a family practice is responsible for reviewing home safety issues with all patients. She knows that there is an increased risk of falls in which of these two groups of patients? A. Infants and the elderly. B. Toddlers and the elderly. C. Infants and toddlers. D. The elderly and school-age children. Correct answer, A. Infants and the elderly. Question 11 Explanation. Infants and the elderly both have increased risk of falls. Nurses should educate the parents and/or caregivers of infants about safe places for sleep and play to prevent a fall. In the elderly, nurses must consider age-related factors, both physical and cognitive, that can increase the risk of falling. Question 12. A nurse is counseling an 87-year-old female patient and her daughter. The patient is obese, has multiple medical problems, including dementia, and takes numerous medications. The patient is preparing to move in with her daughter for full-time care. Which of the following is least important for the nurse to discuss with the patient and her daughter? A. Fall prevention and safety. B. Fire safety and prevention. C. Side effects of her medications. D. Proper ergonomics for lifting/assisting the patient in her activities of daily living. Correct answer, B. Fire safety and prevention. Question 12 Explanation. While fire safety and prevention is certainly a worthwhile topic to discuss, given this patient's particular set of problems of obesity, polypharmacy, dementia, and advanced age, the other choices should take priority during the review of safety and accident prevention. Question 13. A nurse on the medical/surgical floor is caring for an elderly, postoperative patient with dementia who is in restraints because she refuses to stay in bed or keep her IVs in. The nurse knows that she will have to provide range of motion exercises and asks if the patient needs to use the restroom how often? A. Every 2 hours. B. Every 6 hours. C. Every 4 hours. D. Every 8 hours. Question 6. The National Institute of Neurological Disorders and Stroke, NINDS, has set the goal for immediate general assessment by a stroke team or emergency physician as A. Within 5 minutes of arrival. B. Within 10 minutes of arrival. C. Within 20 minutes of arrival. D. Within 30 minutes of arrival. Question 3. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear and anxiety about the procedure. Which of the following is the most effective nursing response? A. Warn the patient to stay very still because the smallest movement will increase her pain. B. Encourage the family to stay in the room for the procedure. C. Stay with the patient and focus. Correct answer, D. Contact precautions. Question 14 Explanation. Impetigo is an infectious skin condition that is spread via skin-to-hand contact or indirect contact of the skin and other surfaces. Contact precautions are, therefore, necessary to limit the spread of this skin infection. Question 15. A nurse is volunteering in an indigent clinic. She is seeing a patient whom she suspects has active tuberculosis. In this disease process, which of the following body systems serves as both the reservoir and portal of entry for this infection? A. The gastrointestinal system. B. The integumentary system. C. The respiratory system. D. The hematologic system. Question 9. The nurse reports to the physician signs of increased intracranial pressure in an infant with a myelomeningocele who has which of the following? 1. Minimal lower extremity movement. 2. A high-pitched cry. 3. Overflow voiding only. 4. A fontanelle that bulges with crying.